NKT2152 is an oral HIF-2α inhibitor, and so we know that the majority of patients with clear cell renal cell carcinoma will have a somatic mutation in the VHL gene. If you have that mutation, you have high levels of HIF-2α, which is a transcription factor, and this is oncogenic. And so by blocking HIF-2alpha's interaction with HIF-1β, you're going to downregulate these genes. NKT2152 will interact with the PAS-B domain if HIF-1α and result in that downregulation, and we believe that this will have a positive clinical effect. This clinical trial was a phase 1/2 study where we had a dose escalation cohort, we had a pharmacodynamic cohort, we had a cohort looking at individuals who are resistant to Belzutifan, which is another HIF-2α inhibitor, and also an expansion cohort. But a total of 113 patients were dosed, and we have valuable information from an efficacy perspective on 100 of these individuals. So what we did see is an objective response rate of around 20% for the overall cohort. In the dose escalation portion, 26%. Progression-free survival of about 7.5 months in the total cohort and 9.5 months in the dose escalation cohort. And the toxicities were typical for this class of agent. We saw anemia, we saw hypoxia, and we saw fatigue as the major side effects. So at this point in time, this study continues to mature, and decisions on how to move forward with this compound in advanced renal cell carcinoma are being made.